Welcome to the show. Today we have Dr. Haffner. Dr. Haffner joins us from Manchester. I want to just jump in. I get so excited talking to someone from the UK. It's an exciting time for us, and there are so many parallels between US and UK dentistry. How did you end up in Manchester? What does your day-to-day look like as an NHS mixed dentist?
So, ending up in Manchester is pretty simple. I was born here and I've lived most of my life here. I studied here. My children go to school here. So yeah, that's how ended up working here. So my day-to-day life, I would say the majority of my work I do is probably NHS dentistry. It's quite normal in the UK for an associate dentist to not just work in one dental practice. So I work across two dental practices. One of them is what we call a mixed NHS private practice, but it is majority
Mhm.
sort of the bread and butter of that practice is mostly NHS. And the other 2 days a week, I work in a fully private practice. I mean, the best way I can describe it is someone once at the beginning of my career, someone once said to me, NHS dentistry is a bit like if when you're repairing a road, it's like every time you see a pothole, you fill it in with something. Whereas private dentistry is you just resurface the whole thing. You begin again and resurface it beautifully. A lot of the UK patients are very entitled, and it's often the less they pay because we actually have exempt patients who are exempt on the NHS. So believe it or not, however cheap their contribution, however little their contribution is to NHS dentistry, there are some people who are entirely exempt, so they can get very high sort of valuable treatments such as molar root canal, crowns, etc., dentures, all completely free of charge.
What is it that drives it? Is it just that's the way it's always been? Where does the entitlement come from?
Medical and all sorts of healthcare in the UK has been, free, state sponsored, with the NHS and general medicine for a very, very long time. Like, you'll never, it doesn't even enter your head booking an appointment to go to see your doctor or anything. Money doesn't enter your head because why would you pay to go to see your doctor? It doesn't come into it. You don't have to have private health
Huh.
insurance to, go and to do that. Your kid's got, sneezes, wakes up in the morning and sneezes, right? You're on the phone to the GP. It's hard to get appointments. They make it difficult to get
I
appointments,
see.
but at the end of the day, money doesn't enter into it. And I feel like people all of a sudden, when it comes to their teeth, they feel, well, you know, I, I hurt my leg the other day and I went to see the doctor and that didn't cost me. So why, when I've got toothache, am I all of a sudden being asked to pay money for it? So there's this
Hmm.
massive sense of entitlement I find in the UK. In America, having to sort of negotiate with the insurance companies and being worried that if you don't take a reduced fee, that you'll end up getting no fee at all. And you just, at least a patient in the chair is better than no patient in the chair. But then you're thinking, okay, I've got this patient in the chair. Really, they've told me there's a slight little niggle over there, but I don't really want to take an X-ray because I don't really want to see that because if I see that, then I'm going to have to sort it out. And if I'm going to have to sort it out, it might end up costing me money. I'll be out of pocket
Hmm.
and it's hard to practice ethical dentistry on the NHS. There's so many different things, so many different factors to juggle with here, and overwork and underpay is
Hmm.
just sort of the icing on the cake, the cherry on the top that really makes it quite difficult to work.
You know, overworked and underpaid is a pretty poor receipt for happiness. Are there differences in age? I mean, is it older population that is more entitled?
I've not necessarily noticed that it's to do with age. I think it's more a complex that we develop. We're worried, like it
Hmm.
could be that, I often feel like I'm just scared to have this conversation about a certain treatment option with a patient because I'm worried to mention how much it's going to cost. Because there are some things which we simply just can't do on the NHS. It sort of builds it creates this inbuilt fear in you because especially when you're working in the UK, you have to start out as an NHS. Well, you don't have to start as an NHS dentist, but it's very, very, very difficult to skip out the NHS and just go fully private, because if you do that, then you can never get what's called a performer number to work on the NHS.
When we hear NHS pressure, is that it? It's not so much the government putting constraint, it's the intersection between you and the patient and the communication and the entitlement and expectations around it. When you feel pressure, is that where it lands?
Yeah, I find it a very stressful, high pressure job to begin with. There's no room for error. There's no room for mistakes. You can't, other jobs you can sort of put your head down for 5 minutes, take a tea break, gather your thoughts again. When you're in the middle of treating someone, and especially when you're doing the more complex procedures such as a root canal or something like that, and you just want to give yourself a minute just to breathe and just to think and and you can't. You've got it, that there's that intense concentration the whole time whilst you're working. And I know I'm fairly early on in my career, but I really find it takes its toll. So when you're adding into the mix the decision making, you know, you know, factoring in the NHS, trying to make it work, so trying to make it so that it doesn't actually end up costing you money, because the government doesn't actually care if you make money or lose money as working as a dentist on the NHS. They just want you to treat the patients and look after them. But the way the NHS remunerates you, it pays you. I mean, until recently, it's slightly improved, but until recently, it would pay you the exact same amount of money for doing a molar root canal as it would for taking a tooth out. Now, one of those treatments takes, 1 to 2 hours, very possibly needs the patient to come back for a second appointment, whereas the other one of those treatments is over in 5 minutes. So
Right.
you try and keep someone ethical when they come to you and they've got an abscess on one of their molar teeth, and you're like, oh, yeah, I could root fill this and spend 2 hours of my time, spend a lot of money in materials if you're the practice owner, and save this tooth. Or I could just have this tooth out in 5 minutes and the patient's on their way and I can get my next patient in. So when you're adding those sorts of decisions into the mix, it just massively increases the stress, increases the pressure. There's no way you can explain to the patient or make them feel or help them feel the value of what you are doing for them, because they're still paying the same amount. From their end, the contract hasn't changed. They still pay the same amount for a tooth extraction or for a root canal.
Why don't more practices go private then?
Fear. It's fear, because NHS equals bums on seats. It's like it's guaranteed income. You have a contract from so the way the remuneration works with the NHS, it's called the UDA system. UDA stands for Units of Dental Activity. So and then we have the system is banded. So you open a course of treatment and do a checkup for a patient. That's automatically you get 1 UDA for the practice. All right. Now, if in that course of treatment you do your checkup and they tell the patient they need 1 filling, or they need to they've got gum disease, they need some a deep clean with the hygienist. So that adds on a further 2 UDAs. So for your checkup and for your filling, or for the hygiene appointment, which your patient's going to come back for another appointment for, that is 3 UDAs. Now the thing is, though, you can only, it's like when you go to a shop and you fill your basket with lots of things and you only pay for the most expensive item. So if they have, on a course of treatment, they have a checkup, they have a clean, they have a filling, they have an extraction, they have a root canal, and they have a crown, they'll only pay for the crown, and that will cover everything. Now, to put things into perspective, a UDA, the value of a UDA is roughly, I don't know because I'm not a practice owner, but I think the total value of a UDA can be anything from around 30 to 40 pounds. The standard, I can tell you what a standard associate gets per UDA is about 13 or 14 pounds per UDA. Some associates can get as little as £10 per UDA. So you could get a dentist doing all of that work in multiple appointments for a grand total of £120. And the annoying thing is, all the patients think that we're loaded. They think all dentists are driving Porsches and going on multiple holidays a year, and it's just not true. But yeah, you asked me about why don't all dentists go private? Because the NHS means bums on seats. So even if you are potentially doing all of that treatment for so little value, you can, when you've got that patient in front of you, you can have your chat about Invisalign, you can have your chat about composite bonding, you can have your chat about tooth whitening, you can have your chats about all the treatments which are private treatments. Now, a lot of the patients won't go for it. A lot of the patients get suspicious. They feel like, you're just trying to sell to them, but some of them will go to it. And the reason why dentists will stick with that is because you're guaranteed to have an audience to at least talk to and offer the private treatments to. Whereas if you start a fully private practice, there's no guarantee that you'll have any audience.
Right now, as an associate, what is the most difficult part of that for you? Do you worry about clawbacks? Do you get into how the patients are scheduled? Talk me through how that differs in the principal versus the associate.
So if we don't fulfill the contract, there'll up to a certain point there is clawback, and then also you might not get the same size contract next year. So that pressure definitely is much more on the principal, but then that does filter down to the associate, because obviously if there's a smaller contract next year, if there's clawback, then it will knock on to us as associates.
It sounds like there are a lot of difficult parts of going private between the consumer behavior and the prospective patient behavior, as well as the NHS devaluing what the freshen is doing. It sounds challenging. And I mean, is it not incredibly taxing on your mental health?
No, it is very taxing. You've hit the nail on the head. It's such a stressful job to begin with. So I mean, I'm lucky in the practices that I work at. They're nice work environments and they're really nice people to work with. I have worked in places before where there's been sort of toxic dynamic within the staff, and it's not been it's not been a fun environment. So I quickly left that practice. But yeah, it is taxing on your mental health.
When we think about what works in the practices that have made the private transition, what is it that some offices get right and what is it that others miss?
I think it's being in it for the long game. So you've got to be aware that the first year, maybe even the first couple of years, you won't even be turning over a profit. But you've also got to be aware that someone once told me the race to the bottom is a very quick, short race, and there are no winners. So it's very easy to be tempted into, okay, I'm opening a new fully private practice. The practice around the corner, they charge X for their treatments. I'm going to undercut them. I'm going to charge less. So that way you achieve nothing. You end up not earning enough money to stay open long term. And you also end up losing this opportunity to communicate what I've been saying, to communicate the value to your patients. You end up being you're no better off than an NHS dentist, but without the NHS contract guaranteeing you getting your patients in there.
When we think of the impact on the staff, when we're talking about your emotional health and being kind of ground down, how does it impact your team?
I mean, when patients are more demanding, like I mentioned about it's usually the ones who pay the least who demand the most. And the entitlement, and they feel like, you're an NHS dentist, you owe it to me to help me out. So they can be quite rude to the reception staff. and that can be quite difficult
Right.
for them. But they're pretty good, and they're pretty well trained at how to handle these sorts of patients.
American dentists are facing a similar version of shrinking margins and pressure. Do you think they're going to learn the hard way if they're not paying attention? Because the UK does seem further along in the evolution of NHS, and some of these challenges are similar.
So I think from what I'm understanding from you, it sounds like they're going to run into this sort of problem of trying to cut their prices to keep their patients or to get new patients, but without the option of having the NHS. So it will like that scenario I described to you about the worst of both worlds. They'll still view it as a lot of money to pay, but you won't have the guarantee that they're going to come back every 6 months for their checkup. They might say, well, okay, the dentist has told me this time I need a crown, but that's the last time I'm going to that practice because it cost me $1,000 for a crown. I don't have that sort of money. Whereas if that would be on the NHS, they'd be like, okay, well, it wasn't, it was a lot less, and also NHS, they view the one thing they do value in England is actually having an NHS dentistry. They might not have an NHS dentist. They might not value what we do, but they feel like they sort of own us, and they want to hold on to us as tight as possible, and they'll keep on coming back in order to keep us, because we do have a system that if they fail 2 appointments, then they get taken off the register, they're taken off the books, and they can't come back as an NHS patient.
Most practices in the US are going private, and they're offering additional amenities like Netflix and massage chairs and sometimes even Botox out of the chair. What do you see is happening similarly in the UK when private practices are opening, and what challenges are there? What are you bringing to the patient outside of dentistry?
The private practice where I work was owned by my uncle for about 40 years. And he was a very well trusted member of the community. Everybody loves him. Everybody trusts him, wants to come to him as their dentist. And then recently he sold the practice, and the new owner came in, and he is a really, really nice guy. The new owner, I love him. He's such a nice guy, but he spent so much money on the practice. The practice looks beautiful now. He's poured a lot of money into the aesthetics of the practice. There's screens on all the ceilings in the surgeries with like you say, with Netflix and whatnot. And you get two types of patients now who come in. You get the patients who come in who will look at it, oh, your prices have gone up, we're paying for all of this. And then you get the other type of patient who just loves the feeling of being pampered. Unfortunately, at the moment, the first type seems to be a bit more common. So it's just working on. You've got to be aware when you spend all of that money going fully private, that there are going to people who are going to be wary. Are going to be like, yeah, well, this is why they're charging so much money, because they've got massage chairs in the waiting room, or because they've got Netflix, they've got to pay for their subscriptions. This is why why everything's so expensive. So you do have to be aware of that. But if you doing what you're doing with confidence, and it's about not just the doing all of this and then talking to your patient in the same way that you talk to your previous patients who you with the insurance plan or with the NHS. You may as well have just kept your plastic chairs in the waiting room, because you showing the patient that there's value here, but you're not communicating that with them. You're not telling them that, and they're going away feeling exactly the same way, if not worse than they would have been beforehand, because now they're just saying, well, it's costing more money, but I'm being treated. They might not consciously realize that, but in the way you talk to them, they'll feel that and being treated the same way. So I feel like it cannot be stressed enough how important communication and talking to your patients and helping them feel in control of their own, their own well-being and their own healthcare, and making them feel cared for, making them feel like you value them. Like they cannot be stressed enough. It's so important.
I saw a quote the other day that said, "You're only as good as your ability to communicate."
Now, when I was starting out, someone once said to me, patients have no idea about the quality of your dentistry. They don't know if you're a good dentist, if you're a bad dentist. They do know if you're a nice person and if you make them feel nice. So being a successful dentist is probably 90% communication and 10% clinical skill. Can I just add one other thing? You mentioned about spending money on marketing. I'm noticing, I don't know if it's the same in the US, it might be, but there's a lot of money wasted in marketing in dentistry in the UK, and that it's sort of just thrown about, it's sort of throwing things around, hoping something will work. You could be paying potentially hundreds, possibly thousands of pounds to land that one patient, and if that one patient doesn't end up taking any treatment of any value, it's just, you're losing quite a lot of money. And yet the ones that do pay for expensive treatment, they end up paying for those patients. But I feel like there could be a lot more efficient way of doing things. And the best analogy I've come up with for it is, at the moment, as dentists, we're all going fishing in the ocean for patients, and we're out in the wild, and we're all focusing on trying to get a bigger net, trying to get a better fishing rod, trying to get better bait to try and catch these patients. But at the end of the day, we're fishing in the wild, and there's no guarantee, what we're going to end up, what's going to bite and what's not going to bite. Beginning, one of the things that motivated me to start filling in was I knew I had a valuable service to offer, and I knew there were people out there who wanted it and just weren't sure about what the right way to access it is. So at filling you in, my long-term goal isn't just for emergency patients, and it's not just for Greater Manchester. I want to be able to create like an aquarium of patients where everyone is neatly categorized. You have let's say 100,000 people, or a few 100,000 people have filled out these forms on the website, and you have patients categorized into, they'll be categorized in, are they interested in straightening their teeth? Are they interested in whitening their teeth? Do they have missing teeth? Are they in pain? And let's say a certain practice in a certain area, they're looking into, they want to push share. They're trying to get more implant patients. So they'll go onto the website and they'll look in the category of implant patients, and there's more than enough patients to go around.
Yeah, you nailed it. That's the world over. The inefficiencies and effectiveness of dental marketing are very loud. And it's the 80-20 rule, right? 80% of your results come from 20% of your effort. And narrowing down to what is impactful, what matters. Dr. Haffner, thank you so much for your time and joining us. Thank you for telling us about the work you do in Manchester. It's been wonderful to hear, even in the midst of all the chaos, there are good people out there working hard to make the NHS and improve the system and improve the dentistry.
Thank you. And thank you for giving me the opportunity to come onto this podcast. I've really enjoyed it.
That was your bite of dental marketing.